a subsidy. Gross, the insurance advocate and co-author of Solved: Curing Your Medical Insurance Problems, suggested investigating individual insurance plans elsewhere. For instance, some unions and trade groups offer policies to their members, and some health insurance companies sell individual policies that aren't available through the ACA. Seek tax savings. If you are self-employed, talk to a certified tax coach and open up a health savings account, HSA, or another type of medical savings account, some of which are also available to people who have employer-sponsored insurance. A tax pro can tell you which savings tool suits your circumstances, said David Steiner, a principal of Zebulon Tax Advisory. Realize you can't control all costs. Much of the cost of health insurance is out of your hands, according to Linden. For instance, government agencies set eligibility limits for Medicaid and income limits that determine whether you qualify for a subsidy through the ACA, and your employer sets the portion of the premium paid by the company. Determining how much you can afford to pay for health insurance is akin to making the same determination for housing, she said. Both are necessities, and the market sets the rates. Account for costs beyond premiums. Americans spent $3.3 trillion on healthcare in 2016, or $10,348 per person, according to the Centers for Medicare and Medicaid Services. Of that, out-of-pocket costs accounted for $352.5 billion. Premiums are only one of many factors that determine the cost and value of a plan's coverage. A low premium might be offset by high co-payments for visits to providers, for instance. So, you shouldn't select a plan based on a bargain basement premium alone. Instead, examine exactly how you've used healthcare in the past to pick the best plan for you. Know the difference between plan types. Premiums and plans differ, but most come with a strong correlation between cost and convenience, said Luskovich, the employee benefits expert. PPO health insurance plans offer the most flexibility, but it's like shopping at a convenience store. Goods are more expensive but quickly accessible. On the other end of the spectrum, you have the HMO, larger, more complex, more time-consuming but cheaper. And there are other plans that lie between APO, POS, HDHP to meet the needs of customers. So, it's important to spoon through the alphabet soup of plan types to find the plan that best fits your medical needs. Research healthcare savings accounts. HSA contributions can be tax deductible, and if you use the money for medical expenses not covered by your insurance, the distributions can be tax-free, said Byron Ellis, Managing Director of United Capital Financial Life Management. There is an annual limit for contributions, and you might find that your company will even chip in and add money on your behalf, said Ellis. Look into flexible spending accounts. FSAs can be a good way to set aside some tax-deductible contributions and pay for health or dependent costs by pulling out the money tax-free. But, make sure you know the